Hi everyone, my name is Liv Grosvenor. My pronouns are she, her, and I'm the Student Mental Health and Wellbeing Strategy Project Manager at King's College London. I led on King's submission to the University Mental Health Charter Award, and in March 2024, we received an award outcome. This presentation is a brief case study of the King's Wellbeing Survey, which was used as evidence in our submission. The Wellbeing Survey is most closely linked to principles of good practice from the Charter framework, both in the enabling themes domain, which are universities take action to understand their populations and staff and students' differing needs and experiences from the inclusivity and intersectional mental health theme, and universities support research into university mental health and wellbeing and the development of innovative good practice from the research, innovation and dissemination theme. Understanding the general mental health and wellbeing of our student population enables us to deliver an informed and evidence-based whole university approach to student mental health and wellbeing. Between 2021 and 2024, we have carried out an annual King's Wellbeing Survey, achieving an average response rate of 4,509 students per year, which is 9.8% of our total student population. The survey is run in partnership between our What Works Widening Participation Research Team, student mental health and wellbeing strategy leads, and academic colleagues in the Institute of Psychology, Psychiatry and Neuroscience. It uses a combination of clinical and non-clinical measures to capture a representation of the mental health and wellbeing outcomes of students studying at King's College, and data is used to inform proactive interventions, clinical services and further research. The survey was launched in 2021 in February and has run annually for 3 years. Data provides us with a snapshot of student mental health and wellbeing within a consistent period whilst measuring longitudinal outcomes for specific student groups. We capture participant student numbers, which enables us to map students' academic outcomes to their mental health and wellbeing outcomes. A summary of student outcomes is shared with faculties to influence localised support, and all of this aligns with our strategic aim to become a world leader in promoting the mental health and wellbeing of our students by drawing upon our clinical and research strengths in mental health. These are a summary of the measures that we use, the clinical measures that we used in the survey, which include GAD2, PHQ2, GP Core 14, PSS, the Perceived Stress Scale, the UCLA Loneliness Scale, the Sleep Hygiene Index, and the Mindful Self-Care Scale. And to say that these scales were informed by research. So we did research into other institutions running similar surveys, and we collated in partnership with academics, the ones that we felt best reflected our student population and which we felt would be most useful to the research. We know that there are gaps in representation for specific groups, student groups in the survey. So you'll see here that's particularly for men and students whose gender is not the same as assigned at birth. We do engage with KCLSU, our students' union, to support with promotion of the survey, although the data collection window is the same as our students' union annual survey, and we want to keep that window consistent for the outcomes of the longitudinal outcomes. So promotion for KCLSU is secondary, but we do work with them to put that out where they are able to. So this is a little summary of what we did to collect our responses. The promotion of the survey is a collaborative effort between the project team, departmental student experience teams and engagement teams, and central student communication colleagues. So those running sort of central student news items. An email is sent via mail merge to all students at King's at the launch date of the campaign, then again at the mid and end of the campaign to encourage students to complete the survey and remind them of the incentives for doing so. The email is sent on behalf of Professor Juliet Foster, our Dean of Education in the Institute of Psychology, Psychiatry and Neuroscience, and Juliet is also the academic lead for student mental health and wellbeing at King's. The campaign coincides with University Mental Health Day, where communications are sent reminding students of our whole university approach to student mental health and wellbeing services available to them, and the opportunity to complete the survey. So those things are both put out at once. Comms are shared with faculty colleagues for them to tailor comms to their specific student groups because they know what works best for their students. Results of the survey have enabled us to share an overview of student mental health and wellbeing at King's, and by collecting student demographic data as part of the survey, outcome gaps for specific student groups have been identified. So we've been able to look at what those are. This has led to or supported interventions such as further research into the specific experiences of students with disabilities and LGBTQ+ student groups, the relaunch of King's Disability Inclusion Steering Group and Institutional Disability Inclusion Action Plan, the introduction of a health advocate for Mandarin-speaking students, and collaboration with belonging and engagement colleagues at King's to benchmark and support students' sense of belonging. To ensure continued engagement, it's essential for us to close the feedback loop with students and staff so that they can understand what we're doing in response to their feedback and in response to their outcomes. So a full report is produced, including the methodologies and all data analysis each year that the survey runs. And this is made available to relevant colleagues to review the data in more detail to understand their student groups in more depth. That report is accompanied by a Power BI dashboard for other relevant colleagues at King's to review the results in a more accessible format. So we ensure that that data is shared in a multitude of ways so that different stakeholder groups can access it in the way that they need. Findings inform our institutional you said we did activity as part of our national student survey and postgraduate taught education survey campaigns. So we roll some of that into our wider You Said We Did campaign. And the results are also presented at our student survey management group, working with faculty colleagues to communicate local findings. So we then work with student experience managers at a faculty level so that they can understand how to embed the findings and think about the results at a local level. These are just some lessons learned on sort of cross-university working. So the survey's open to all students and is an opportunity to connect our student support and engagement services with research practice at King's, which helps to then inform our strategic approach to student mental health and wellbeing. We have a data sharing agreement, which means that the researchers in the IOPPN at King's support with the analysis, and they provide senior sponsorship to the work, and that just helps to reach more students and to onboard staff with what we're doing. And we do have a small team, so that means that we've got limited resource to present analysis. So we really need to make those results and those recommendations as accessible as possible so that they can be communicated out by other colleagues and not just the immediate survey team. And we produce a range of resources to enable colleagues to do that. One of those is the Power BI dashboard. And it's also an opportunity to work more closely with departmental student experience colleagues, supporting them to understand how to use the data. So we present that data back to them, and then they can understand or think about ways that they can embed interventions and use those findings in their local areas. The success of the survey relies on a consistent completion rate that is representative of the student body. So another challenge is that our data collection window coincides with, like I said, the NSS and the PTES, that's the National Student Survey and the Postgraduate Taught Education Survey. This is because it's the most effective time of year for us to do it, but it does coincide with when we're asking students to complete other surveys. So the way that we've sort of moved around this is that to ensure that our communication is very clear in the difference between those surveys. We've adapted our communication style to ensure that this is the case, and our survey project manager works closely with colleagues to understand their specific communication requests. The survey project manager is also responsible for roadshowing the survey ahead of the data collection window at various meetings across the university, and this encourages buy-in from a wider stakeholder group, including academics, student experience personnel, KCL Students' Union, and strategic marketing and communications colleagues. So that's sort of a rundown of the communication approach and how we ensure that lots of students complete our survey. We've just finished the third round of the survey, and the data analysis is being done now. So that data was collected in March, and now we're awaiting for the complete set to come back to us. But we were really, really excited that that was considered an area of good practice in our award submission. And then we were also very fortunate and proud that that led to us also receiving the award. So if you do have any questions about that, then my contact details are on this slide, and hopefully you're able to enjoy the or copy and paste anything that you need from the slides, and also enjoy the case study. Thank you very much.